Welcome everyone to an informative journey into tuberous sclerosis complex, associated lung disease, often abbreviated as LAM in the context of TSC. This rare condition can significantly impact the lives of those affected. Join us as we delve into the depths of this complex disorder, exploring its origins, effects, diagnosis, and potential management strategies. So, what causes this specific lung manifestation of tuberous sclerosis complex? The primary culprit lies in mutations within the TSC1 and TSC2 genes. These genes are responsible for producing proteins called hamartin and tuberin, respectively. When these genes malfunction, it disrupts the mTOR pathway, a crucial signaling network that regulates cell growth and proliferation. This dysregulation can lead to the uncontrolled growth of cells, ultimately contributing to the development of LAM. Now, let's understand the disease's inner workings. In T-associated LAM, abnormal smooth muscle-like cells known as LAM cells proliferate and infiltrate the lung tissue. These cells often contain mutations in the TSC genes. This infiltration leads to the formation of cysts, or air-filled spaces, within the lungs. These cysts disrupt the normal lung architecture, impairing gas exchange, which can result in shortness of breath and other respiratory difficulties. Furthermore, the LAM cells can invade blood vessels and lymphatic vessels, further compounding the lung damage. TSC affects an estimated 1 in 6,000 newborns. However, TSC-associated LAM specifically affects a smaller subset of these individuals. Women with TSC are much more likely to develop LAM than men, suggesting a hormonal influence. While the exact prevalence of TSC-associated LAM remains uncertain, research indicates it affects approximately 30% of women with TSC. It's important to note that LAM can also occur sporadically, meaning without any association with TSC. This sporadic form is far more prevalent than TSC-associated LAM. The signs and symptoms of TSC-associated LAM can vary greatly from person to person. Some individuals may experience no noticeable symptoms, especially early in the disease. However, as the condition progresses, common symptoms can include shortness of breath, especially with exertion, chronic cough, chest pain, and recurrent pneumothorax, which is a collapsed lung. In some cases, LAM can also lead to chylothorax, a buildup of lymphatic fluid in the chest cavity, or angiomyolipomas, benign tumors in the kidneys, which are more commonly seen in TSC. Diagnosing TSC-associated LAM typically involves a combination of clinical evaluation, imaging studies, and sometimes lung biopsy. High-resolution computed tomography, or HCT, scans of the chest are crucial for visualizing the characteristic cysts in the lungs. Pulmonary function tests can assess lung capacity and airflow. In some cases, a lung biopsy may be necessary to confirm the diagnosis and rule out other conditions. Additionally, genetic testing may be performed to identify mutations in the TSC1 or TSC2 genes. While specific classifications or types within TSC-associated LAM aren't formally defined, understanding its context is key. It's always associated with tuberous sclerosis complex and should be differentiated from sporadic LAM, which affects individuals without TSC. Identifying the presence of TSC stigmata during clinical evaluation plays an important role in diagnosis. Currently, there is no cure for TSC-associated LAM, but treatments are available to help manage the symptoms and slow the progression of the disease. The mTOR inhibitor sirolimus, also known as rapamycin, is often prescribed. This medication helps to reduce the size of LAM cells and stabilize lung function. Bronchodilators can help open up the airways and ease breathing difficulties. Pulmonary rehabilitation, including exercise and breathing techniques, can also improve lung function and quality of life. In severe cases, lung transplantation may be considered. Unfortunately, there's no way to directly prevent the genetic mutations that cause tuberous sclerosis complex. However, genetic counseling is recommended for individuals with a family history of TSC who are planning to have children. Early diagnosis and management of TSC, including monitoring for lung involvement, can help to mitigate the potential complications of LAM. The prognosis for individuals with TSC-associated LAM can vary widely. Some individuals may experience a slow and gradual progression of the disease, while others may have a more rapid decline in lung function. Recent research has focused on understanding the molecular mechanisms driving LAM and identifying new therapeutic targets. Clinical trials are ongoing to evaluate the effectiveness of novel treatments and strategies for managing this complex condition. Continued research and advances in medical care offer hope for improving the lives of individuals living with TSC-associated LAM.